Hey there folks, this is Larry Chu here. As you can see, we're changing the format of these videos a bit to be practically focused to help folks in healthcare who want to learn how to partner with patients in their work, understand a bit how to do it more effectively. In this episode, we're going to learn about patient partnership in research, why it's important, why you'd want to do it, and some practical things to consider on both sides as we try to put ideas into action. Just a couple things before we get on with this episode. A few things to mention. Don't forget to click on the subscribe button over on the Medicine X YouTube channel. That way you'll get to know when any new videos, if you like this kind of content, are posted. It's also kind of a way to let us know that you're out there and you like us. Don't forget to follow us on other social media channels for updates, including our Facebook and Twitter channels. Okay, so let's dive into the topic of patient partnership and research. It's something we've been talking a lot about over here at MedX for a while now, as something researchers should be doing more of at each stage of the research process. We recently had Medicine X ePatient alumna and 3-time breast cancer survivor Liza Bernstein stop by our Medicine X studio to share some of her thoughts about patient partnership in research. And I'm going to let you hear from her in a second. But before I do, a few data-driven facts for those of you who are watching who aren't convinced of the value of patient partnership in research. So Ken Getz, a health economist at Tufts University, and his colleague Bennett Levitin from Janssen, and others published a study in the July issue of Therapeutic Innovation and Regulatory Science where they looked at the financial value of patient engagement in clinical trials research, and they found a $100,000 investment in patient engagement returned a $62 million expected net present value for a typical oncology development program entering phase 2 clinical trials, and an increase of $35 million for phase 3 trials. But get this, it's more than just money. Patient involvement saves time, and that can save lives for people waiting for life-saving oncology treatments to come to market. Patient engagement in this study accelerated pre-phase 2 product launch by 2.5 years, and by 1.5 years for pre-phase 3 to product launch. But partnering with patients doesn't just end once the research is done. Our own research here at Medicine X has shown that patients can be powerful partners in sharing research results with the public, amplifying that work beyond the narrow research communities into broader public communities, and doing so in ways that people engage with more actively than when healthcare providers, researchers, or physicians share that same information. Work by other researchers has shown that patient participations at research meetings broadens the research agenda, and the type of questions scientists work on improves the quality of science being produced and increases the measurement of outcomes that are patient-centered or likely to be meaningful to patients in helping them make decisions about their healthcare. Yet, our recent Medicine X research found that patients represent less than 2% of voices at most healthcare conferences when we studied social media conversations. So, if I've managed to convince you through the past short few minutes from just a few studies that have been produced in recent months showing the value of patient partnership in research, how do we go about meaningful engagement and partnership? At Medicine X, we believe in a framework we call Everyone Included, which is a way of seeing the world where we bring patients and caregivers together with researchers and scientists on equal footing in a setting of mutual respect and inclusivity, and we leave room for understanding on both sides so we can build trustworthy relationships that lead to open and honest discussions that are the basis of meaningful engagement and co-creation. You'll hear over the next few months how we build trustworthy relationships at Medicine X. But let's start by hearing from a patient herself. I recently asked Liza Bernstein to visit our Medicine X studio to share some of her thoughts about patient partnership and everyone included. Let's hear from her now.
I've had cancer 3 times, 3 primary diagnoses of breast cancer. That means I've had 3 separate, brand new from scratch breast cancers. The first one was in 1994, and the following 2 were in 2005 and 2009. I've had surgeries, I've had chemotherapy, I've had radiation, I've even had early precision medicine where we used molecular testing to find out what the profile of my tumors were, at least in 2005 and 2009. And those tests helped myself and my doctor in collaboration figure out treatment protocols that were, as tailored as possible to my particular tumors. So patient-centered outcomes research is important to me because I feel that the patient voice really needs to be incorporated into how we decide how to treat whatever it is we're going to treat. Because the medicine in and of itself is not enough. The medicine in and of itself, most of the time, yields side effects, and those side effects can be completely devastating. So how might researchers best work with patients, especially when considering patient-reported outcomes? Well, to me, the answer to that question is really simple. Ask us. Not only ask us, but perhaps provide the space for us to also propose ideas that should be researched. If we are going to train students to effectively carry out patient-centered outcome research, I have a revolutionary suggestion. Forget the actors, stop hiring actors, bring in real patients, talk to them, ask them questions, interact with them, and you will begin to notice that an actor, while they might be able to simulate some kind of symptom, cannot give you the 100% 360-degree picture of what that symptom really means to that patient. We need to bring patients in on the ground floor. We need to partner patients with students. We need to partner patients with researchers. What I'm trying to say is I think we've forgotten humanity, basic humanity of all of the stakeholders in the healthcare system. I was at the AACR, American Association for Cancer Research, part of the Scientist Survivor Program, where cancer survivors have to apply to be a part of this program, and they get to interact with scientists. And one of the most common things we heard was that so many scientists had never met a patient, and so many patients, myself included, had either never met a scientist or had only met 1 or 2 here and there. So ideally, I think patients and scientists need to spend a lot more time together, get to know each other as people, and see how they might collaborate to really create patient-centric and patient-informed research. And it's not that scientists aren't interested in patients, it's just we're in different worlds doing different things. I've tried to foster some of that. Earlier this year, I was working for a company called Cure Forward as the Precision Medicine Advocate Program lead. And I moderated and curated a whole bunch of tweet chats under the hashtag CTSM, Clinical Trials Social Media. I invited Angela Alexander, who is a breast cancer scientist at MD Anderson, to be the featured guest on our tweet chat. And we had the most incredible conversation, we being all the people who were present on the tweet chat, and it included other researchers, patients, all different stakeholders in the space. And Angela told us about, her journey to becoming a researcher, why she studied breast cancer, how she interacts with patients, and so on and so forth. I think it's about people bravely and boldly stepping outside of their comfort zones, following their curiosity. I'm talking about both patients and researchers, and finding ways to just connect and talk to each other. We're all people.
So, to wrap things up, how does this relate to medical education? Medical education is a unique opportunity to do two things: teach medical students how to become a doctor and teach medical students how to become researchers. During school, medical students have lots of different opportunities to make medicine better, which includes learning how to do research. The different research opportunities that medical students can take on include things like summer research internships, research classes, and working in a lab. Every single one of these things lays the groundwork for medical school students to become physician researchers. By teaching medical students early on to put patients at the center of research, we can graduate doctors that know how to do patient-centered research and create a culture of patient-centered research that is everyone included. So that's just a glimpse of some of the insights from a patient perspective about how to go about patient partnership. There's so much more we could cover, and I promise you we'll get into it in future episodes. So what's on your mind after watching this episode? We want to hear from you. Please leave us some comments below. If you are a researcher who's partnering with patients, let us know what you're working on and what's worked for you and what you found as your greatest challenges in partnering with patients. And if you're a patient, how have you seen partnership work in research from your side of the process? And how could you see the process improving? And in general, for everyone out there, what is the one misconception or misperception you think the other side has about you that you'd like to clear up in order to help build better working relationships with each other going forward? Please share your comments below, and we'll try to work on answering them in future episodes. A quick reminder, make sure if you haven't done so already that you subscribe by clicking on that subscribe button on our YouTube channel. And if you like this video, click the thumbs up button. And I'd really appreciate it if you'd share this video with other people you think would like to see the content that we're posting out here on YouTube. That's it for now. For Medicine X, this is Larry Chu. See you next time.